This module is part of the ERN eLearning curriculum regarding the future of diseases from the mosaic disorders. This presentation has been developed by two persons. Marjolein van Kessel, patient advocate for people with congenital melanocytic nevi, in short CMN. The second of her 3 children died of the neurological complications of CMN when he was 13 years old. She is the president of Nevus Global, the international patient organization for people with CMN. And Lex van der Heijden, father of a young woman with cutis marmorata telangiectatica congenita, CMTC, and founder of the global non-profit patient organization in 1997 for patients with CMTC and other vascular malformations, their families, and healthcare providers. The impact of a rare disease. The European Organization for Rare Diseases, EURODIS, frequently conducts a survey called the Rare Barometer. Currently, about 7,000 rare diseases have been identified which affect approximately 30 million people in the European Union. On average, it takes 5 to 7 years to get a clinical diagnosis, and in more than 40% of the cases, this diagnosis is wrong more than twice, which can have a huge impact on the patient and the family. The burden of disease can be huge and is directly visible during daily life. 7 in 10 patients and carers reduced or stopped professional activity due to their family member's rare disease, which also often causes financial problems for the family. On top of caring for the patient, there are other daily tasks such as household chores, preparing meals, and shopping. These responsibilities become even more heavy and complex when the child with the rare disease has brothers and sisters. A patient is never alone. A child's diagnosis also has an impact on everyone in the household. When the disease affects the first child, the parents need to find a new balance as husband and wife. If they already have children, the whole family will have to get used to the new situation. Birth and diagnosis. When a child is born with a rare disease and you do not yet have a correct medical diagnosis, you feel lost and not understood. Then, when you finally get the medical diagnosis, you have to face a future with unknowns. What will the future look like for our child and for us? What can or can't our child do later in life? What is the life expectancy of our child? What is the impact of this on our family? Will our child be able to live independently and have a good life? And so on. Another survey from Rare Barometer's Voices shows 7 in 10 parents find all this time-consuming. 6 in 10 find this very hard to manage. In addition to daily tasks and adjusting to the addition to the family, maybe with the mother not even completely healed from the delivery, parents have to deal with the coordination of care. Diagnosis. Some rare diseases can be visible at birth, such as CMN. Some are only visible under certain environmental circumstances. Some rare diseases are inside the body and become known by means of symptoms. Parents have to arrive to acceptance, which is the first phase of mourning. Mourning because their child is different than hoped and expected. It's very important they quickly learn about the disease and possible consequences. Therefore, we recommend immediate access to a multidisciplinary team in an expertise center acknowledged by the European Reference Network. Information about where to find the expertise centers should be readily available. If the closest expertise center is far away, it should be possible to consult clinical experts by the Clinical Patient Management System, CPMS. This is a secure software platform that enables health professionals to discuss difficult cases at an European level. Parents need reliable and understandable information about the disease, preferably in their native language. Dr. Google is rather often the first steps parents take to find more information. However, Dr. Google does not indicate if the information is reliable, accurate, and up to date. The impact of having a child with a rare condition can be enormous, not only for the parents, but also for the siblings, grandparents, friends, and other family members. It is recommended that they get psychological and psychosocial support offered. Referral to a patient support organization will be helpful for sharing experiences, finding personal support, and getting information. Finding other parents having more or less the same experience allows them to address questions and maybe even get some answers. There are many ways to connect people with similar experiences. Patient organizations are very good at bringing patients, families, and healthcare providers together and providing reliable, accurate, and up-to-date information. People from a patient organization have personal experience in coping with the disease, not only regarding medical experiences, but also in daily life, such as at school. Treatment and follow-up care. Whether to suggest treatment or not depends on the current complications or complications that could be expected based on knowledge or experience. The transfer of a patient from childhood to adult care needs special attention. Be aware that the patient could feel very comfortable with the clinician he or she has been dealing with her entire life, and now needs to switch to another person he or she doesn't know at all. This requires building a new relationship based on trust. Transition to adult care can also have consequences from a psychological point of view. Is the patient mature enough and cognitively and mentally able to make decisions independently? Treatment of rare diseases is commonly a world of unknowns. Treatments being used are not necessarily generally accepted, and information about results are limited and scattered over the entire world. Here is an example for CMN. When offering treatments like removal of nevi for CMN, the problem is there's a lot we don't know. We still don't know the exact risks of developing melanoma when removing nevi of different sizes with different techniques or not removing them at all. We also can't predict with accuracy who will develop neurological symptoms. And most important, we don't know how to treat the deadly form of neurological involvement. So we need further research to learn more about how to assess the risks, possible treatments, and their outcomes. Here is an example for CMTC. The variety of possible complications is huge. Some can be predicted in a number of cases, such as brain issues in cases where the markings are located on the head. In order to be able to compare outcomes, standardization is required. Patient-reported outcome measures, PROMs for research, and data collection. We need international guidelines so patients and parents receive information based on concrete numbers of multiple cases and not opinions. In case of serious issues with the disease, symptoms could be lethal. It turns out that finding the proper expertise is hard, more so regarding specific complications. Rare diseases don't stop at borders, and the expertise per country could be very limited or even not present. At this point, we need continued access to multidisciplinary teams in expertise centers. The multidisciplinary team may not know all about possible treatments. We should not be held back by borders to seek for consultation worldwide. International collaboration is crucial, especially in the rare disease arena. Tools should be present to share clinical and genetic data among specialists across borders in a secure way. Having a child with a rare disease has an impact on the entire family. Professional counseling may be necessary to learn how to cope with the social impact of the disease on the patients and their families' lives, because the rare disease can be a challenge in daily care. Access to a multidisciplinary team. Over the years, the relationship between the doctor and patient has changed. In the past, the doctor was the expert and the patient received the clinical diagnosis and treatments. As things changed, Patients were put in the center of the group of clinical experts, resulting in patient-centered care. But the influence of the patient regarding the treatment, etc., was still rather limited. Nowadays, we are talking about partnership of care, where the patient is part of the care team. The input and influence of the patient are crucial. Decisions are taken in cooperation with the patient. The intention is also to empower the patient and to give him or her control over his or her life as much as possible. By working in a partnership of care, the doctor's medical knowledge is combined with the patient's experience to the fullest. This structure is the best holistic approach for positive health or treating the disease. Nothing about us without us. Vision for the future. Number 1. Finding a preferably local expertise center and patient organization quickly and easily. The ERN Skin has developed a smartphone app with a number of features based on the Orphanet code. The app shows by means of a map where an expertise center is located and where the associated patient organization is located. Number 2. Genetic research looking more broadly than only specific genetic mutations associated with a particular disease, trying to understand the mechanism of the disease and possible correlations with other similar diseases. Number 3. Patient-reported outcome measures, PROMs, must be taken into account and need to be standardized. Number 4. Medical and genetic data of particular patients made available for broad research on behalf of other patients. Of course, this needs to be arranged according to the General Data Protection Regulation. Number 5. International guidelines so patients and parents receive information based on concrete numbers of multiple cases and not on opinions. These guidelines should be developed in close cooperation with patient organizations. Number 6. A holistic approach. A patient is more than a body. A disease also has an impact on the patient's psyche, such as self-image and self-trust, and the psychosocial self, being limited at school and activities with friends. The well-being of the parents, their brothers and sisters, and grandparents should be taken into account as well. Number 7. Expertise centers refer to patient organizations. The parents need a portal to ask all kinds of questions and receive personal support by experienced doctors in their own language. One of the main tasks of a patient organization is also to connect patients and parents and to share personal stories. Number 8. Clinical data is too often dispersed over a number of different systems at a series of healthcare providers. Many hospitals have electronic patient portals to give patients access to their clinical data. However, the general practitioner also has clinical data, and so on. The solution is to have a complete overview of all clinical data in one place under control of the patient. The patient determines who has access to which data and when. This requires a central patient health record that should be developed in the whole European Union. Number 9. CPMS, Clinical Patient Management System, is currently being used only by clinicians as a clinical tool for diagnosis help. We would like patients to be more involved in care, in interaction with HCPs, and that it becomes possible to get virtual contacts for adapted information with experts. Number 10. Artificial intelligence should be applied for a quick and reliable diagnosis, based on data as mentioned in item 4 and for prediction of possible complications in the near future. This approach could prevent a lot of issues for patients and their families, and at the same time reduce healthcare costs.